On Health Her Way, we're asking the questions you want answered about your body.
Together with our female healthcare experts, we're diving into the questions that might seem too scary, too silly, trivial, or taboo. No topic is off limits.
Join us as we talk about Health Her Way. Welcome to Health Her Way. I'm Brooklyn Elbert.
And I'm Meredith Cunningham. And today we are joined by Dr. Ramya Undamatla, and she is a board-certified endocrinologist with Covenant Health, serving patients at Grace Clinic. And I'm excited to have you here today. In my 7.5 years of doing this, I never once have interviewed an endocrinologist.
Happy to be here. Hopefully we can all learn something. I'm sure I'll learn something from you guys as well. So yeah, I'm excited to be here. Thank you for having me.
We have lots to learn.
We have lots to learn, but I think you're going to learn just how confused sometimes people can be about health. And that is exactly why we are here today.
Yes, ma'am.
We're going to remind everybody, this is an entertainment show. Do we trust our experts? Absolutely. But should you still go talk to your doctor before you change anything in your lifestyle? Also, absolutely. So we're going to all learn from each other today.
Good.
Let's start with a general understanding.
Sure.
What is our endocrine system?
Yeah, so good question. So the endocrine system basically is a network of organs in our body that either produce, store, or secrete hormones or do all of the above. And it is really important because it is going to affect everything in our body. So it's going to affect your metabolism. It's going to affect your sleep, your mood for the day. It's going to affect, how often you go to the bathroom, how often you wake up during the night. So it's really essential to make sure that all of these hormones are in balance. But the good news is that your body is doing a great job of it, like 99% of the time by itself. We just need to help it along just a little bit. So, yeah.
So what are some common signs that your endocrine system might be out of balance?
Yes. So there is a lot of talk about hormone imbalance on the internet, anything that you are looking at on, TV, Instagram, TikTok. But like I said, most of the time, your body is doing a pretty good job of keeping everything tuned. Things that you may notice if things are off balance, though, would be mostly energy issues. You could have issues with sleep. A lot of times patients come to us mostly with weight issues. So you can see both weight gain, weight loss. And those are kind of things that make us as endocrinologists think, okay, maybe something else is going on here. Things that are more extreme, you can have issues with, frequent urination, feeling thirsty all the time. That's a big one that we see for patients with uncontrolled blood sugars. And a lot of the time, that's how patients come to us. And that's how we know that we need to check for things that are going on.
Who do you see more in clinic with these issues? Is it men or women?
So a lot of it would be women. So I think diabetes, for the most part, is pretty well balanced between men and women. But thyroid disease, especially, we know is much more common in women. And it can be up to 9 to 10 times more common in women than in men. So I would say a good portion of the patients that we're seeing in clinic with thyroid issues, especially, would be women. And then we do see a lot of endocrine disorders such as adrenal, pituitary issues, and even, something like PCOS, which is polycystic ovarian syndrome. A lot of those are going to be very specific to women just because of our reproductive organs. So I would say it's a good mix, but if we are taking out diabetes, it's probably 75-80% of our patients are women relating to hormonal issues. And, you have a good 20% that are men, probably, I would say.
Well,
how many podcasts have we done so far? Like maybe 20 or something at this point. And every single time, every single expert talks about hormones and how they can mess some things up.
Mm-hmm.
And you just listed a whole host of reasons why or what is impacted by them. How do they get off balance? I mean, if our bodies are these wonderfully, beautifully smart things, how do they get so out of whack all the time?
Yes. So unfortunately, like anything, it's probably multifactorial, right? So a lot of it could be genetics, something unfortunately that you're born with. And we do see some evidence of familial predisposition. So a lot of times, someone comes to me with thyroid issues and, the first thing they tell me is, my mom or my maternal cousin or my paternal cousin had this issue. And so they're kind of already thinking about that as they're moving through life because, someone would have told them down the line, hey, I have a thyroid issue, so you should be more aware of these things. Type 2 diabetes, which a lot of people think is more lifestyle related, which it definitely can be, also has a really big genetic predisposition. So if your mom or your dad may have even type 2 diabetes, and especially type 1 diabetes, you can definitely be more predisposed to that. And then, unfortunately, in these days, we are also seeing a lot of environmental influence. What we eat, what we drink, everything we put in our body or anything that we're exposed to can unfortunately, interfere or quote unquote damage our endocrine system. So I definitely think that as we are developing more as a whole, the downside to it is also that we're just seeing more and more chemicals and things like that that can unfortunately disrupt our system as well. So,
Okay, I have a question. This may not be related at all, but
Sure.
I'm going to bring it up because that's what this podcast is about. She and I both decided to stop using aluminum deodorant.
Okay.
I gave it a 5 or 6 months or whatever. Hated it.
Okay.
Yeah. It gave me like a rash.
It
too.
gave
I don't know why.
the same. I smelled. I
Yeah.
sweated. It literally did nothing to help.
Yes.
So, but what is it that people talk about all the time when it comes to like aluminum? Like, why is it so bad for us?
So it is not as bad for us as we think it is. And if you
Okay.
talk to a lot of dermatologists who I would say, probably are the people who talk about this the most of them actually are okay with us using aluminum in our deodorants. A lot of times if our patients are talking about it, what I'll recommend is, try to use the aluminum deodorant overnight. And this is a big thing that a lot of people may not know, is that actually if you use the deodorant overnight, you're going to get a lot more benefit than if you're using it during the day. And then especially if you're going to be more active during the day, sports, activity, walking, whatever that may be, I recommend continuing using the aluminum deodorant. And then if there are days that you may just be at home and you're not active and you just want to do something a little bit more natural, then you can definitely go aluminum free. But that specifically may not be as bad as we think it is. So, but
Love hearing
so
that.
you guys are good to go.
We're in the clear.
Good, because we both went. I mean, like, I was like, man, it wasn't just a couple of weeks. It was 5 months later. I'm like, it's summer in Texas, okay?
Yeah.
Like,
I think especially in West Texas, it is a no-go.
Yeah. I think I started it this summer too, and I was like, nope. No.
but okay, so deodorant aside, because that's one of those wives' tales or rumors that we have to clear up. What other things, you said chemicals and things, but what else is disrupting our can I say that word? It's a hard word to say.
Yeah.
Our hormones.
So I think, unfortunately, as women, we are probably more exposed to these things than men. And that's just because we tend to use more things in our life, day-to-day life. And the big things that I usually recommend thinking about are, things like perfumes and your makeup products. And you're not going to probably be able to avoid them completely, obviously, but trying to minimize exposure to that is really helpful. And more now, as we know more about these chemicals that can really affect our endocrine system, thankfully companies are also being, more aware of it, and they are making things which are less, using less of these chemicals or are free from these chemicals. The other big thing that I think as women that we may not think about is menstrual products. A lot of those are going to contain chemicals, so trying to maybe switch to reusable things, like whether it's period underwear, menstrual cups, or even just trying to use like organic cotton for your period products, that may be really helpful. Because when, we spend, unfortunately, at least a good 1 week a month using those, and that's a big source of exposure for women. And then cookware is also a big thing that we need to look at. I think most of the companies now have really started doing away with, nonstick cookware and using more ceramic cookware. So looking at those companies and trying to incorporate more of those into our life would help too a lot. So
I've converted to the cast iron
Yeah.
for most things.
or that was fantastic.
I'm just thinking about everything that we put in our body,
Mhm.
on our body,
Mhm.
around our body.
Yes.
It's disrupting.
Breathing in things and even drinking water. Unfortunately, there's been a lot of studies that show like microplastics in water. So we're not going to be able to avoid it, and I don't think people should freak out about avoiding everything, but it's a very good principle to try to minimize things as much as possible, and I think that's all we can do right now. So
Yeah, I've heard about that with like the Stanleys, the hydro jugs, hydro flasks. So you really just can't avoid it.
You can't avoid it, but I don't think there's a point in trying to just cut everything out of your life, because we do want to make sure that we are still enjoying life, but there's definitely alternatives now. And I think as we learn more about these chemicals, we're going to have even more alternatives available, hopefully, so we can start to utilize more of those.
What average age do you start seeing women coming into your clinic kind of complaining about like the thirstiness or all the other things that you were saying?
So I'm an adult endocrinologist, so we start seeing patients age 21 and above. I would say probably a large portion of our patient population would be late 20s, early 30s is kind of when we start seeing those issues. We definitely have people who are older, postmenopausal, 50s, 60s. There's kind of most of the things that we have for endocrine are what we call biphasic. So you see an initial jump when we're younger, maybe 20s, 30s, and then maybe you have a period where you're not as predisposed to these things. And then you have another kind of period, maybe 50s, 60s later on, where you kind of see another jump with that. But yeah.
So flipping gears a little bit to pregnancy, can you talk about pregnancy and how the pregnancy hormones can throw off your endocrine system?
Yes. So we do see a lot of mostly thyroid issues and diabetes in pregnancy, because any time a woman is pregnant, unfortunately, think of it as a stress on our bodies. And it is, right? It's stressful emotionally, physically, mentally. So you are seeing more stress on the thyroid. And a lot of times when people come to us, they may not have had any issue up till now with their thyroid, and they develop it just during pregnancy. But unfortunately, once you develop thyroid issues during pregnancy, most of the time you are going to need to continue on thyroid medication after pregnancy. It's usually not a situation where it's going to taper off by itself or resolve itself. There are some conditions that where that occurs, but I would say the majority of the patient population, that's not going to be the case. With diabetes and with pregnancy, you do become more resistant to insulin. So you may be eating the exact same things, you may be as active as before, and for whatever reason, your body's not processing it as well, unfortunately. So we do see patients who develop diabetes during pregnancy, and we call that gestational diabetes. Again, with a gestational diabetes history, you are now more predisposed to developing diabetes down the line. So usually once you have a diagnosis of gestational diabetes, I will continue to check a hemoglobin A1C, which is a screening marker for diabetes, usually post-delivery, and then every 3 to 6 months, just depending on how their levels are looking. So you do need to continue to monitor that after delivery.
You mentioned pregnancy being a stress on the body, and I can attest that it is. But what about regular stress that we experience? Some people obviously have situational stress that is very normal, but some people may have more stressful jobs or more stressful lifestyle at home. How does stress, especially long-term stress or chronic stress, disrupt or mess with our endocrine system?
So usually when we're stressed, the big hormone that most of us think about is cortisol. And that can be a very normal response to things. When you're stressed, your cortisol increases, and that's what we want to happen because our body's preparing to either fight something, flight something. It's a natural response. But as you said, if it is a chronic stress reaction for days or weeks or months, it can become detrimental. And again, increase in cortisol can be make you more insulin resistant. Thyroid issues. Sometimes our patients, come in and they say, I was doing perfectly well, and then I had a big stressor in my life, and that's kind of what set off my thyroid issue. So we do see kind of an effect of all of that. And the other big thing is it can throw off your menstrual cycles, and that's a big red flag for, I would say, most endocrinologists, most people who come in. If they're in the reproductive age group as women, one of the first things we'll ask is, how are your menstrual cycles? If they're regular, continuing on as normal, it is very reassuring because that's going to be one of the first things to really be thrown off by anything going on in your life. if it's something you're looking at in terms of fertility down the line, that can be a big issue too, especially if you're under chronic stress with high cortisol levels. It can start to affect fertility as well. So it's something that we look at as a whole. We want to try to treat the root cause of it, whether that's, meeting with a therapist, a counselor, starting medication for that specifically. We don't do that as endocrinologists, but we're, certainly happy to point you in the way of our mental health colleagues so that they can help you out with that.
Something we want
Yes.
to ask you is a conversation that's been had all over the internet, whether it's TikTok, Instagram, whatever. All these people saying that you have high cortisol, you need to fix it. Here's how you do it. Tell us, is that a legitimate thing that we need to be concerned about?
So the first thing I would ask myself, if you are seeing something on the internet that way, is can this person actually name 3 different hormones in your body and what they do? And if they cannot, I would swipe right or left or up or whatever that is. So the problem is, you are going to make someone on cortisol throughout the day, and that's what we want. So actually, cortisol is highest in the daytime when you're waking up, and that's what we want because our body is just naturally trying to wake up. We want it to, have energy and do all the things that we do first thing in the morning. So we're not necessarily trying to decrease or control cortisol at that time. Where we see an issue as endocrinologists is if, unfortunately, an organ in your body is making cortisol consistently and constantly. So during the day, it's high, during the night, it's high, and you're not seeing that normal increase during the first thing in the morning, and then it usually tapers off during the evening. And that's to, get you more relaxed so you can go to bed and have a restful, sleep. And when we see that disrupted is when there is an issue. So really the only way to check that is to check a cortisol level. And it's even more nuanced than that because we're not looking for just, you can't go to a lab and just draw a cortisol level and say, okay, is this high or is this normal? We're looking at what time of day it was drawn. And most importantly, in most endocrine things, we're looking to see if it's abnormal. And the only way to test that is to try to suppress it. And if it is not suppressed, then it's abnormal. And that's for most endocrine things and most endocrine hormones. So I think when most of these influencers, let's call them influencers, are well-meaning. And what they're probably trying to, help with is just decreasing stress levels. And that's a great thing to do. What I think in all of this, though, unfortunately, cortisol has become vilified. And I would say if you truly think you are having a cortisol issue, talk with your primary care physician first. If they feel like something's going on, I am sure they'll be happy to refer you to an endocrinologist so that they can do further testing. When people come to us with true cortisol issues, kind of the symptoms or things that you would look out for, rapid weight gain. So it's not usually a more gradual weight gain, 5 to 10 pounds, let's say every year. You see a big chunk, like 30 to 40 pounds in maybe 6 months even, that's just come on all of a sudden, non-pregnancy related, non-medication related. Other things that you can see is, and this is really clear for a lot of our patients, when you look at pictures and you're looking at pictures over the last 6 months, you can kind of see your face round out, and we call it like a moon face. And that tends to happen for a lot of our patients with cortisol issues consistently. The other thing that you may notice is onset of diabetes, new onset diabetes, new onset high blood pressure, new onset cholesterol issues. And then going back to mental health, a lot of our patients can actually develop depression with high cortisol. And so that's another red flag that we look for. You can also, in kind of the extreme side of things, develop things like really bad muscle weakness. So you won't be able to even stand up from like a sitting position, and even blood clots. So there are pretty severe things that you can see with consistently high cortisol. And so most of the time, if you're just stressed all the time and you're trying to reduce that stress, there's definitely other ways to do it, and it's not necessarily cortisol induced. But
Yeah, this is kind of random, but I was looking at starting a new workout.
yeah.
And it's like a high intensity
Yes.
class kind of thing. And I saw videos and it was like, this actually made my cortisol spike and I
Yeah.
gained weight. And I was like, what? So yeah, it is
You have a bad
very
hip,
misleading.
so
Yeah.
I'm
So
like,
basically,
I'm worried about you for other reasons.
the bad hip came from that workout. So.
But
Yeah, no, I don't think, and yeah, high intensity, exercise, that's another thing that's really gotten a bad rep recently.
Mhm.
And I don't think there's anything wrong with that. It's, how much you're doing of it and how it's playing into your exercise regimen. Yes, if you're doing high intensity exercise 60 minutes a day, every day, and you're using it to, you know, lose weight in an unhealthy way, yes, it may be an issue, but high intensity exercise by in itself is perfectly fine. And it is going to probably increase your cortisol. And again, that's just a normal, natural response. And once you're done with the exercise, it should just come back down to normal. A lot of times when patients are doing high intensity exercise, the weight gain that we may see is just from appetite regulation issues. So, you're doing more high intensity exercise, you're just naturally more hungry, possibly. And if you're not accurately tracking your calories or keeping track of that, you just may be consuming more than you did previously. And then that could result, theoretically with weight gain. So that's
Okay.
kind of what we see.
Yeah.
so thank you, influencers, for making us aware of our cortisol, but maybe the doctors should be the ones that fix it.
Yes.
Mhm.
Okay.
Yeah.
So
Well put.
So, speaking of exercise, are there specific exercises women should do to support their endocrine health, or should that be changing based on like your hormones and cycle?
Yes. So cycle syncing is another big thing that's kind of all the rage right now. There's not a whole lot of evidence for it, honestly. What I usually, tell our patients is you kind of have to gauge it on how you're feeling. So we have, kind of to go back, we have two main periods in our menstrual cycle as women. The first, 14 days or so of our menstrual cycle is the follicular phase. And then the last 14 days or so would be the luteal phase. Now, the luteal phase is when we have a lot of progesterone on board. And a lot of women may not feel the best during that time. Now, that could be variable. You may be one of those people that actually feel great during that time. And so cycle syncing basically is a concept where you are doing a lot of activity, exercise, whatever that may be, during your follicular phase or the first 14 days, just because you are, you're more energetic, you feel better, your mood is better. And then for the next 14 days of your cycle, you're doing more gentle exercises just to kind of, modulate your nervous system, make sure you're calm, make sure you're improving your mood. And in theory, it sounds great, but I think in practice, are you missing a good 14 days of the month that you could actually be, weight training and doing all the things that you do the first 14 days of the month? But if you are really feeling terrible for those 14 days, I say don't push it. Yeah, if those days meditation and yoga, maybe Pilates sounds great to you, then that's what you include on those days. But in terms of general exercise, I always do recommend incorporating some aerobic exercise. It does not have to be running. If you like to run, have at it. It's a great form of exercise. But it can be something as simple as what we call low intensity steady state, which is really just walking. And doing 20-25 minutes of that a day is going to give you plenty of benefits in terms of heart health and just regulating your hormones. I do also recommend at least 2 or 3 days of some sort of resistance training or weight training. And I hate to say it, but Pilates does not count. I know people love Pilates, and I think it's a great form of exercise. And if you love it, please keep doing it. But you're not probably putting enough stress on your muscle and your bones when you're doing Pilates to necessarily improve your muscle architecture, to build muscle, and to actually have impact on your bone density. So I would actually truly try to pick up some weights and start weight training or weightlifting. And if you need help initially, please make sure to, see a certified personal trainer. Make sure you are getting your form right and start as low as you need to. But there's so much more research now that weight training and resistance training is not only important for your bone health, but for also your heart health. And I think as women, as we age and we're losing that estrogen protection, we naturally tend to lose a lot of muscle. And the best way to try to prevent that is to incorporate this into your regimen as soon as you can. 20s, early 20s, even younger is fine. So yeah.
as an avid Pilates goer, I will not take that offensive. No, I actually get it. A lot of us do have other avenues, other gym memberships or whatever, just because also the same thing all the time gets a little boring no matter how much you love it, you know? So I will say some teachers are harder than others. Trust me, there are days where I'm like, oh my God. But I do understand what you're saying, even as somebody who does personally love Pilates. But that's helpful to know, like, from your opinion, especially the cycle syncing. Is there anything else that you feel like you would like us to know about endocrinology? Things that people get wrong or things that people get right, or somebody may not know?
I think another big thing is thyroid and weight, which we talk about a lot in our clinic. So yes, having untreated thyroid issues or not being on thyroid medication when you need it can cause weight gain. It's not as big a weight gain as most people think. It's usually about 8 to 10 pounds. And some people, may maintain their weight even if they have uncontrolled thyroid issues. The big thing to remember, though, is once your thyroid hormone is in range because you're on the appropriate medication and the appropriate dose, your metabolism is not different from someone without thyroid issues. And a lot of times I think so much gets put on the thyroid or blamed with the thyroid that we're missing maybe the bigger picture. And so if someone's telling you, hey, this is purely your thyroid, I would, really take a step back and say, okay, is my thyroid hormone okay? Have I seen my endocrinologist and made sure that that's all within range? And if it is, we may need to look at other things, whether that's environmental, other hormone things that could affect weight, before we kind of, make sure, before we blame it on the thyroid, essentially, is what I think. But
do patients need a referral from a PCP to see you?
yes, and it's not the same for all endocrinologists. I would say probably, I do think, as far as I know, all of the endocrinologists in Lubbock do need a referral. Yes.
Okay. Good to know. We just don't want people to be like calling your office and they're like, hi. You're like, okay, that's great. Love to see you, but hold on one second.
Yes.
Okay. Good to know.
And it doesn't necessarily have to be your primary care physician. If you're seeing your cardiologist and something's going on and they think you need to see an endocrinologist, it just needs to be, a healthcare provider.
Okay. So good to know.
Well, now it's time.
Now it's the fun part. So we're going to have you reach into this little bowl and pick out a trending topic.
Okay.
And read it and then give us your expert advice, please.
So what supplements are worth taking? And this is a loaded question because I read something recently that like the supplement industry in the United States is like $1 billion.
I believe it.
I don't know if it was trillion or billion, but it is a huge thing. And again, influencers and TikTokers are well-intentioned and are trying to promote probably their own supplements to a large extent. A lot of things that I see that I would not waste your money on. I'll start there. Athletic greens.
Okay.
It's a proprietary blend and it's not entirely clear what exactly is in that. I think you'd be better off spending and it's expensive. I mean, if it was $3-4 a month, I would say, it can't hurt, have at it, but it's expensive. And I think you may be better off just, maybe trying to buy fruits and vegetables and other great things with that. Maybe some whole grains. The other, big thing that we see is selenium and zinc, which do have some role in the context of thyroid disease. So if our thyroid patients would like to start something to just help them kind of support their thyroid, I have no issue with the selenium in supplement. There is some small evidence for it. You do need to be careful about the dosing. So please ask your healthcare provider what dose would be appropriate for you, because you can very easily get toxicity from these things. Another kind of big thing would be, things that say adrenal supplement or adrenal support or thyroid support. A lot of these things, the thyroid kind of supplements, quote unquote, have a lot of iodine in them. And sometimes the iodine in them is so high that it can actually damage your thyroid, whether it can make you overactive in terms of thyroid function, and sometimes it can make you underactive. So if someone comes to me with thyroid issues, I really try to recommend and counsel them that we should not be taking these thyroid supplements. Now, the adrenal supplements, A lot of them are made from animal adrenal glands. So the problem is when you take cortisol of some sort from an external source, when you're putting it into your body externally, your body senses that you're getting it externally, and it shuts down your own adrenal glands, which make cortisol. And then you are trying to get them to recover, which is a very long process, years. So I would really talk to your healthcare provider before you take anything. I definitely would not take anything off the internet that you don't read thoroughly, because a lot of these things may not necessarily state it on the back as clearly as they should. Uh, and then the other big thing I would look at when you are taking supplements is try to make sure they're third party tested. That's a great indicator of someone else is looking at them apart from the people who are making these supplements. So at least you have some other person that has laid eyes on what this is made of, because most of these supplements are not regulated by the FDA, unfortunately. Um, so those are kind of the big things that I see in clinic. Things that I would recommend taking. Vitamin D is a big one that I usually recommend for a lot of our patients. Unfortunately, even living in West Texas, as hot as it is, as much sun as we get, I would say a good 80-85% of our patients are deficient in vitamin D. But check your levels first. So not everyone needs a supplement for vitamin D. So it's a very easy test for your healthcare provider to run. So check your level first, and then they can make an informed decision on how much you need to take. You can get vitamin D toxicity. So if you are taking, I would say, more than 5,000 or 10,000 units of vitamin D per day without having your levels checked, maybe something to ask your provider to check into, just to make sure you're not overdoing it with the vitamin D. And then for vegetarians and vegan patients, I usually recommend a vitamin B12 as well, because they're usually going to be a little bit deficient in that. But those are kind of the two main things that I recommend for our patients who are on medications to lose weight, or if they've had surgery to lose weight. I will also usually recommend a multivitamin, and sometimes they end up needing iron if they're deficient in that. But other than that, I mean, you usually are good to go as long as you're eating a fairly balanced diet, I would say.
That's some great advice. Thank you. Thank you for helping us learn what to do and what not to do. That was helpful. So, well, thank you for being on today. You guys stay with us. If you have any questions, of course, visit us on Health Our Way on Instagram, Facebook, listen on Spotify, and anywhere else you get your podcasts. And we'll see you next time.
This podcast explores health-related topics with experts in their specialty for entertainment purposes only.
The information shared and discussed should not be considered as medical advice under any circumstance and is not intended to replace professional medical advice.
The views expressed do not reflect the views of Covenant Health System. For questions related to your personal health, always contact your physician.